It sounds like, Stephen, we're in for 2 days of live court hearings. This FETA case, of course, drawing a lot of attention. Well, since the start of the COVID-19 pandemic, concerns have been raised about whether people who are compromised by HIV or TB are more susceptible to the virus. Aisha Abdool-Karim of the Bhekisisa Center for Health Journalism joins us now for more. Aisha, good evening. Now, there's been some interesting data in terms of the breakdown of those that are suffering from COVID-19 and these underlying comorbidities. Let's talk about what the key findings of this data, especially coming out of the Western Cape Department of Health, has been.
Yes, so today the Western Cape Department of Health announced this is the first data set coming out of Africa, and it's the largest data that we have on COVID-19 and its effect on people with HIV and TB. What they found is that people with TB and HIV have a 2 to 3-fold increased risk of dying from COVID-19. So while it is a higher risk to people who are immunocompromised, it is much lower than we initially expected. As you'll recall, when we first started seeing the coronavirus pandemic spreading to different countries, it was mainly hitting countries that didn't have a very high burden of TB and HIV. So there were concerns that South Africa would see quite a high number of cases and also a large number of deaths because we have such a high burden of TB and HIV in this country. So what this information is telling us out of the Western Cape is that while these populations and these people are experiencing a slightly higher risk of having more severe cases of COVID, it's not nearly as high as we initially anticipated.
Now, there's also been some interesting findings in terms of diabetes and hypertension. Those two as underlying comorbidities also catching one's eye there in terms of the data.
Yes, so in fact, what you'll find is that the Western Cape data mirrors what we've seen internationally, which is quite reassuring because it also confirms that we can trust this data. So we've seen coming out of China and other countries that have had this epidemic quite severely, we've seen that people that are older are at higher risk of having more severe cases, and people with underlying health conditions also are more likely to see more severe cases. So this includes diabetes, high blood pressure, hypertension. And in South Africa, that's really no different. In fact, from the Western Cape data, about half of the deaths that they saw there from COVID-19 were people that had diabetes, versus with HIV, it was only about 1 in 10 of the deaths were with people that had HIV or were HIV positive. So what we're seeing is that definitely the high risk groups are still people with other health conditions. Primarily diabetes is comprising the highest risk group right now. And so that helps us compare to, like, internationally, we are seeing the same patterns locally.
Were there any limitations in terms of this data? What are the biases that we should be factoring in when we're analyzing the figures that were being given?
Yes, so I think it's important to note that this was not a formal study that was done. This is just data that was available to the Western Cape because they had been collecting patient records through their health system. So this is more of like an overview of the data that they've seen, and it's a preliminary analysis, so it doesn't have the kind of detail that you might see coming from a research study or a trial. It also wasn't able to have some of the nuances that you might have gotten out of a trial setting, which is it wasn't able to account for other risk factors, like, for instance, if somebody was overweight or if somebody was a smoker, or it also couldn't account for people's socioeconomic backgrounds and how that might impact their risk for COVID. What the benefit of the study is that while it might not have that nuance, it was able to sample a very large number of people because it was coming from the Department of Health. So it was able to give a much broader overview of the risk for that entire population. And why that's important is because the Western Cape currently has the highest number of COVID-19 cases in the country. So getting this picture from them helps give insight to how this epidemic could play out in other parts of the country. So in a way, it helps guide us by seeing which groups were at highest risk in the Western Cape. Also helps tell us where to divert resources in other provinces and other parts of the country.
Sure. You're bringing me to my next point, Aisha. I mean, has the Western Cape been clear in terms of how this data is now informing their approach to things? We know that on the testing side, they've already had a shake-up there, but what does it mean going forward?
So I think it still remains to be seen exactly how this will translate into policy. It obviously is coming from government, so it could be considered in how we form our response, and it will form part of that. What it gives an indication for is because up until now, we really haven't known how people with HIV and TB are affected and their risk when it comes to COVID-19. So it's hard to tell how many resources need to be diverted to those epidemics during this time. So now that we have a concrete number and we can be like, okay, so this is the risk that these populations face, it helps direct where our response is focused. And it also highlights that because there is a risk from these groups and also people with other health conditions like diabetes, it just emphasizes that when we're focusing our energy on the COVID-19 response, we cannot be diverting resources away from other epidemics. We still need to be combating our high TB burden and the high HIV rate that we see in this country if we don't want it to take away health resources and compound on the COVID-19 epidemic that we see locally.
All right, Aisha, let's